Now let's move on to the another muscle of the anterior compartment of the arm, and that is the small muscle, that is coracobrachialis muscle. So the coracobrachialis muscle, as the name suggests, coraco, that means it has some origin from the coracoid process and it reaches up to the brachial bone. So it reaches up to the humerus only. So the name is coracobrachialis derived. So the origin of this coracobrachialis muscle, it is from here, and that is the tip of the coracoid process just medial to the biceps brachii. And this muscle, it passes downward and laterally, and it is going to reach up to the middle of the medial border of the shaft of the humerus. So the insertion of this muscle is somewhere here, and this one is the middle of the medial border of the shaft of the humerus. So this muscle, it is a very small muscle. When we see the nerve supply of this muscle is by the musculocutaneous nerve, whether we can say this musculocutaneous nerve is going to pierce the coracobrachialis muscle. And after piercing the coracobrachialis muscle, this musculocutaneous nerve also going to supply the biceps brachii and the brachialis muscle. So this one is the musculocutaneous nerve. When we see the action of this coracobrachialis muscle, it is a weak flexor of the shoulder joint, and it is also an assistant muscle for the adduction of the shoulder joint. Now, this muscle is a very small muscle, but when we see the morphology of this muscle, actually in case of the quadrupeds, this muscle having three heads, and this out of them, out of these three heads, the two heads, they are going to arise from the coracoid process, from where this coracobrachialis muscle is getting origin in the human being. And this between the two heads, this musculocutaneous nerve is going to pass, and that's why in case of the human being, the both the heads are fused, and that's why we can see that this musculocutaneous nerve is going to pierce this coracobrachialis muscle, while the third head, in case of the some lower mammals, the third head, it is going to arise from somewhere here, which one is the supratrochlear spur. It is a additional bony mass. And from the supratrochlear spur, the muscle is going to reach up to the medial epicondyle of the humerus. So in case of the human being, in some individual, this third head, it remains as one ligamentous band, and this fibrous ligamentous band, it remains between the supratrochlear spur, which is a additional bony mark in some individual, and it reaches up to the medial epicondyle of the humerus. And this fibrous band is called as the struther's ligament. So this Truders ligament is nothing but it represents the remnant of the third head of the coracobrachialis muscle. It is present in some normal individual of the human being. The clinical importance of this Truders ligament is that when this ligament is present, under this ligament, the brachial artery and the median nerve passes, and the compression over these structures will lead to the vasomotor symptoms as well as the median nerve palsy symptoms. So this is the Struther's ligament. So the Struther's ligament is frequently asked as the short question or in the Viva question. Many MCQs are also going to arise from this topic, and that's why this small topic is important. One more important thing regarding this coracobrachialis muscle is that when the insertion of this coracobrachialis muscle is there, when we take a section over there, many changes occur from the upper half of the humerus to the lower half of the humerus. So let's see the changes occur at the middle of the shaft of the humerus at the level of the coracobrachialis insertion. So here this one is the transverse section of the arm. And for the orientation purpose, This one is the anterior side and this one is the posterior side, and here on this is the lateral side and the medial side. So when we see the middle of the shaft of the humerus, on each side there is one muscle attached, and on the medial side this coracobrachialis muscle is going to attach, and on the lateral side this deltoid muscle is going to attach. The second change occur is the movement of the brachial artery from the anterior side to the lateral side. So this one is the brachial artery. The third change occur is with this nerve, and the median nerve, it passes on the anterior side from the lateral side. So this one is the median nerve. One more change is going to occur at the middle of the shaft of the humerus, and is that this radial nerve is passes on the anterior side from the posterior side, and the ulnar nerve, it passes posterior side from the anterior side at the middle of the shaft of the humerus. When we see the two cutaneous nerves, the medial cutaneous nerve of arm and medial cutaneous nerve of forearm, they are going to pierce the deep fascia and become cutaneous at the middle of the shaft of the humerus. So all these are the changes occur at the middle of the shaft of the humerus. So this is all about the coracobrachialis muscle as well as the clinical importance of the struther's ligament. Hope you understand well. Thanks for watching.